Okay, guys, we actually shifted away from the normal intravenous route of drug administration and oral route of drug administration, and we're actually talking about some rare routes of drug administration, okay? And one of these is actually the intra-articular, all right? So anytime you hear intra-articular, that's inside the articulations, okay? And what are the articulations of the body? Those are basically where bones meet bones, okay? Those are the joints, okay? So intra-articular route of drug administration is what we'll be discussing in this YouTube video. So intra-articular route of drug administration, you can see that they are basically administering the drug through the root, okay, through a joint on the body. So intra-articular is basically administering the drug into a joint space, okay. You could be doing this, maybe there's pain in the joint, there's inflammation in the joint, so there's tenderness of the joint, so you are trying to like administer the drug directly to the joint. And what are the advantages? If I could ask you, the advantages is this: the joint is where the problems is at, okay? So you applying the drug directly to the joint now, you are basically saving time and you are making the drug reach the joint in higher concentration. Rather than you know that the joints have problems and you're going through the oral route of drug administration, the drug has to go through digestion. It will reduce the effect of the drug. Okay. So the intra-articular space, intra-articular route of drug administration is you administering drug into a joint space and is generally performed by joint injection. Okay. Now it is mainly used for what symptomatic relief in osteoarthritis. Now intra-articular is employed for injection of antibiotics and corticosteroids in inflamed joints, okay? Like when you have rheumatoid arthritis, okay? So you want to actually just hasten the period, just like apply the drug directly to the joint that has the problem. So you use the word intra-articular route, okay? So intra-articular administration of drug is administering drug into a joint space. It is used in treating osteoarthritis. Common drugs you could use is what? Corticosteroids and hyaluronic acid, okay? And here we also had corticosteroids too, okay? So this is quite everything you need to know about intra-articular route of drug administration, okay? Administering the drug directly into a joint, okay? To solve a problem that might range from what osteoarthritis or rheumatoid arthritis, okay? Or even septic arthritis, okay? Or any condition that has to do with maybe joint. It could be that, okay, you dislocated the joint and you need to actually get a pain reliever directly to the joint ASAP, okay? So any of these medical conditions can actually fit in the intra-articular route of drug administration, right? So guys, that's it about this route of drug administration. Pretty straightforward, and see you guys in the next tutorial. Bye.